Hey, it's Kat at Orion Billing. This is part 2 of the very detailed medical billing step-by-step to go over the software, the process, and how it all works together. I will link part 1 in the description so you can find it. Probably there will be a part 3, in which case I will also link that. This is a crash course, so I'm covering a lot here. If you haven't seen part 1 yet, I do recommend watching that first so you can track along with the rest of this information I'm going to go into. And just to note, so nobody yells at me about what's missing, I am not trying to cover every aspect of medical billing here. Many different specialties can have many different methods of operating. I am truly trying to just give you a more detailed, but still it's an overview because there's a lot of detail to the field and to every aspect of everybody's job in this process. Okay, so in part 1, I mentioned that I have a medical billing flowchart here, which I created to train my own staff. So if you want a copy, just send me an email or go to my website and send a contact message requesting it and I'll send it to you. Okay, continuing here, we have just talked about insurance benefits verification, and so we are on to the first wave of potential front desk collections. This can be where the front desk informs the patient that they will owe a deductible amount for their services, or that their copay is $50 and will be collected at their visit. And if you know exactly what services the patient will be getting, and you're collecting a flat amount according to their insurance verification information, then you can collect that payment right then in advance of their visit. The next step here is patient treatment. This is obviously where the patient is seen by a provider or receives your services. Potentially the patient comes through, gets their height and weight checked by a medical assistant, and that info is entered into the documentation while the provider is seeing the patient, just to continue to include how the software works with all of this. The provider, either during the visit, sometimes if they have the ability, or afterwards, does their full clinical documentation, their medical note, the preliminary coding potentially, and they sign and lock their notes. This is an important step as well so that everyone can see that the documentation is complete for billing purposes, and so that it could be downloaded and sent to an insurance company or to other medical providers as needed. Now, at this point, there is normally some system in place, whether it's via the software or on a piece of paper, that the provider will communicate to the front desk the exact services the patient has received so that the front desk can calculate what the patient owes. If they're a cash patient, that's pretty straightforward. If the patient has insurance and they will owe a specific amount for their deductible or their coinsurance, which is a percentage, the front desk can calculate that, or your insurance verification person or billing assistant, if you're lucky enough to have one, will calculate what the patient may owe and discuss it with the patient if needed to explain their policy to them a bit, which is a good idea because the patients very often do not fully understand their own insurance. So this falls on us as a part of good customer service to help them understand their own insurance and how it works so that they understand what they will owe. It's wise to have your front desk trained for this or to have someone in your office who can do this, even if it's an outside biller. If my team is helping a practice who doesn't have anybody who can do this, we will offer to reach out to them to explain their coverage to them. So as I mentioned in part 1, clinics that do a good job with this upfront make more money and have less manpower needed on the back end for chasing patients for payments. One thing I want to mention here that I should have covered in part 1 when we talked about insurance verification is that any information that you receive from an insurance company at that point is an estimate. Insurance companies always include a disclaimer that what they quote may not be accurate, and they take no responsibility if the claim processes differently than what they told you. So that means you could end up going back to your patient to collect more, or you may owe them a refund, and you are required to track and refund patient overpayments, just to mention. The actual patient responsibility amount isn't confirmed until the claim processes and the payment information comes back from the insurance company. So I always recommend that whoever is at your front desk quoting benefits and collecting money has a simple one-liner ready to go. Something like, your insurance company doesn't guarantee that this is correct, so what we're collecting today is an estimate. If it ends up being more, we'll bill you for the difference, and if it's less, we'll refund you. That one sentence can save you a significant amount of patient frustration and save you a lot of phone calls later on. Okay, so now on to billing. So for the billing, at this point, the person who is doing the billing can review or enter the coding into the practice management software. Either the codes are already there and came over through from the EMR and can then just be verified or questioned as needed, or the biller pulls up that patient's clinical documentation from the visit and enters the diagnosis codes and procedure codes for that visit from the EMR. And then the practice management, the PM, takes all of that, the codes, the patient demographics, the insurance information, and creates a claim. So the insurance claim put together in a software is put into a standardized, universally recognized format. This function in a practice software allows you to create an electronic claim file, which is called an 837 file. It also allows you to view and ideally print onto paper a paper CMS 1500 form or a UB04 form, which is mainly used for hospital billing. The 837 is the electronic version of the CMS 1500 claim data. These standardized formats are recognized by every insurance company, every clearinghouse, every payer in the country. So no matter where that claim goes, everyone receiving it and their software know exactly how to read it. They're all speaking the same language in these electronic claim files, and that is the foundation of electronic billing. So once the claim is created, it can be double-checked and usually edited by your biller before they batch out the claims. Sometimes the software will do this automatically. I recommend strongly against the automaticity because human eyes on a claim before it leaves the building makes a big difference in your reimbursements, in my experience. But that's a whole different subject. So once the claim is created, then it goes to the clearinghouse. And we will talk about exactly what a clearinghouse is, what it does, and what it's good for in the next video. At this point, thanks for watching. Look for more information in the description of the video, and I will link the other parts to this series there also. Have a great day.